Hello, welcome to the Health Show, your premium source for the latest healthcare and wellness news. The world is rapidly evolving, and right now it is crucial for us to stay informed with global health trends here that will give us a dive into innovations, researches, breakthroughs, and impactful stories that will help people about our healthcare facilities. When policies are made, they are meant to impact people. They are meant to inspire and empower people. But when you gain such knowledge, what do you do with the knowledge? It is good to transfer such knowledge into action, and such actions are carried out by persons who are mandated by law and by national policies to implement them. Yes, that gap of knowledge and action making in health is a priority every Nigerian must have. The Health Show starts right now. Welcome back to the Health Show. With me in the studio today is a specialist who has been mandated by law and has been given the authority to implement policies around eradicating the HPV virus. The HPV virus is a human papilloma virus, and that virus is believed to be ravaging different persons in the world with different kinds of infection. In the studio with me today to throw more light on that is Dr. Ahmed Rufai Garba, the Director, Disease Control and Immunization of the National Primary Healthcare Development Authority. Dr. Rufai, you're welcome to the show.
Thank you very much.
We are supposed to be watching something together. Take it away. Let's see it.
5 million new cases each year. According to the World Health Organization data from 2015 to 2019, about 47,199 new cases are associated with cervical cancer. Statistics show that the highest prevalence of cervical HPV among women is in sub-Saharan Africa, about 24%, followed by Latin America, 16%, Eastern Europe, 14%, and Southeast Asia, 10%. Approximately 75% of sexually active men and women may acquire an anogenital HPV infection at some point in their lives. Over 42 million people are infected with some strains of HPV, which many of them don't even know.
Human papilloma virus. That's all I know about it.
It is spread by body fluid, like blood, sexual intercourse. That's how it is being spread. Or, yes, those are the two main routes or way that is being spread.
Human papilloma virus, HPV, which is a disease they contact through flesh to flesh.
And I believe it's one of those viruses that are spread from human contact. And it's one that actually has various side effects on the human body. And it could actually even lead to long-term cancer.
There are different strains of HPV infections. About 40% of them can be spread by direct contact with the genital areas, as well as the mouth and throat. HPV 16 and 52 are the main strain in Eastern and Southern Africa, while HPV 16 and 35 are the main strain in West African countries. HPV falls into two major categories: the low and the high risk. The high risk has the following types: 16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, and 59. HPV 16 and 18 are responsible for most HPV-related cancer, particularly cervical cancer. In Nigeria, HPV infections vary in different parts of the country. People with weak immune system are at risk of the disease, Also those with multiple sexual partners, damaged skin, and contact with surface that have the virus. Sometimes no clear symptoms because HPV infections are asymptomatic and resolve on their own. But with regular checks, you can find the abnormal cells and treat it before it turns cancerous. Note: some of the infections may go away on their own and may not cause any serious health problems. 80% of new HPV infections will clear up or become undetectable within 2 years, while some may degenerate to more serious health issues. There is no cure for most HPV infections, but there are treatments for health issues associated with some of the virus. The good news is that there is a vaccination which is highly effective at preventing infections from the most dangerous types of the virus. The vaccines cover different types of HPV. Gardasil protects against HPV 6, 11, 16, and 18. Gardasil 9 protects against HPV between the range of 6 to 58. And Cervatrix protects against HPV 16 and 18. The Center for Disease Control and Prevention recommends routine vaccination for boys and girls at age 11 and 12. There is also a catch-up vaccination for males up to age 21 and females up to 26. If not vaccinated earlier, adults between the age of 27 to 45 may be vaccinated after a screening is done. There are many benefits of having the vaccination done, some of which are as follows. It reduces the risk of developing HPV-related cancer and genital wart, provides long-lasting protection, decreases the overall prevalence of HPV in the population. The vaccine have been extensively studied and are considered safe. The vaccine is widely available through healthcare providers, clinics, and school-based programs. Regular screenings such as pap tests and HPV tests for women are important for early detection of potential problems. Ensure you go for regular checks, and remember, your health is in your hands. Let's build wellness rather than treat diseases. Let's create healthy habits, not restrictions.
So, Dr. Rufai,
Yes, ma'am.
you have seen everything on the mini documentary.
Yeah.
The numbers are there, but what numbers are we looking at here? They mentioned a lot of strains of the HPV. Which ones are we dealing with as we speak in Nigeria? As the person designing, planning, implementing, and monitoring the output of government policies with regards to mitigating this particular infection.
So first off, let me say this. So we have different interventions from the government, right? Where I work as the Director of Disease Control and Immunization, our main mandate is to bring the vaccine to the populace, put it out there, and it is free for all. So we saw the figures, but let me just put this out there. For Nigeria, by WHO records, on an annual basis, we have about over 12,000 people, or let's put it as women, that have been detected with this virus. Of this, we get to lose maybe like 8,000, 7,900 and something, around that figure. It's really a bad
That's
figure.
about 60%, 50%,
Yeah,
60%.
it's really tough. It's actually very tough, you know. But the thing out there is that the information, you see that populists do not really know about it.
Yeah, going by what was...
And yes, we'll take some of that blame, but something that we're not doing properly is we have now gone out there to actually put the information out there. Beyond just putting the vaccine out there, we're talking about the dangers of the infection, how it is contacted, and why we need to get these vaccinations out there. So it's a serious matter for us. Cancer of any type. Cervical cancer is the second most common cancer for women, followed after breast cancer. And we have beginning to see cases of younger people, In Guagualada, just last year, the specialist hospital there, there were 2 ladies. One was 23 and the other one was 26. And they were actually diagnosed with cervical cancer. And that's heartbreaking.
Indeed.
Yeah, it's quite heartbreaking.
Okay, so I know you are taking the blame. I won't blame you for everything because I know you also have pushback in your effort of disseminating information about the uptake of the vaccine. You have pushback from misinformation from different quarters within the country, from churches, from religious organizations. Some of them are telling their members not to take it because if they do, they are going to become infertile or they are going to die when they take it. So something would happen to them. Well, so taking the blame, I'll just put a stop to it because Nigeria is a very peculiar place. We have to keep pushing. I'm aware also that your agency is trying to do with the national campaign, you're implementing the vaccination amongst children between the ages of 9 and 13. So how far have you gone with that, looking at where you're coming from October last year?
Yeah, thank you very much. Regarding that, let me just correct something. It's actually 9 to 14.
9 to 14.
14 years for girls. Not saying that the boys are left out, but from the quantity of vaccines that we were actually able to assess, we needed to do that for girls because the girls are the ones that are now prone to cervical cancer. You know, Nigeria has a huge population and all of that. We were able to roll out the vaccine in October last year, and to the special grace of Allah, we succeeded. Why I say we succeeded is we have been able to hit our targets in terms of the rollout. But we are continuing in terms of putting the vaccines out there in our public health facilities where caregivers and mothers can actually take their daughters to go get this vaccine. We have been able to roll out in all of the 36 states and the FCT. And looking at what we've been able to achieve, we've been able to reach greater than 80% of our projected population for that particular cohort.
Age range,
beginning from next year, the vaccine is available in the health facilities for 9 to 14 years girls right now. By beginning from next year, 2025, we restrict it to 9 years old ladies. In the rollout phase, where we did what we call a multi-cohort campaign, it was a pretty successful campaign. Despite all of that, you understand, and it's something that the country should celebrate because we're being celebrated globally. We were able to reach over 12 million of these young girls, yes, in all across the country. Okay, and that's something that has not been seen in most countries.
Yes, I think we need to remark in this particular program that the Minister for Health, Dr. Pate, has really done well in the past 1 year. Let me put it that way, because once he came in, the rollout began. I am aware that it has been implemented in other countries around the world, but we are just starting ours for very many reasons. But not minding, at least we have started. Those persons that were not able to follow the global rollout plan, what plan do you have for them?
So, like I said, let me just go back to the Honorable Minister. We have unprecedented support from the ministry and from Professor Pate himself. So what he did to support us is to make sure that we get every resource that we needed. And in terms of even advocacy to our global partners to ensure that these vaccines actually arrive when we planned it, and also guiding us in terms of strategy to ensure that, yes, we do it really well. And through my executive director, Dr. Muya, we got all of this support. We worked with international partners. We worked with the local NGOs, CBOs, traditional leadership, religious bodies, the ministries, different. This is the first time that we went all out, all the ministries, Ministry of Education, Information, Ministry of Defense, and even the school boards and all of that, because one of the strategies that we did was to use the school program to actually go to schools, work with the teachers, and be able to get all of these girls, because that age group, you find them mostly in schools during the primary 6, then in a little of them in secondary, some in secondary schools. Yes, it's something that we should be proud of.
I'm very proud of. I'm very proud of my minister. I'm very proud of the Minister of Health.
We should be proud of.
Yes, at a forum, I actually celebrated him for what he has done. Nigerian women are grateful to him. Our children are grateful to him, and also I want to thank your agency
Yeah.
for putting your weight behind this. I've followed you closely, and I think we're doing a good job of it. However, nothing is too much.
Yeah.
How much do they pay to get the vaccine for the children between the ages of 9 and 14?
Just like all other vaccines that are out there, BCG, the polio vaccines, all of the vaccines, the childhood vaccines, and even including that for women of childbearing age, which is the TD, it is free. HPV vaccine is free in private, in public health facilities.
So my people at home,
Totally
it is free. It is free. The agency mandated with, implementing this immunization it has told us it's free. So please go out and get your jab. Get your children to get it. For the children, it's free. From the primary healthcare centers, you can get this vaccine available. Our time is already up, Dr. Rufai, but we've covered a lot. The good thing is that we are looking forward to eradicating cancer within now and the year 2030.
Exactly.
And for those persons that were not immunized before now, they can go to a primary healthcare center, do a check, and then take your jab if there's a need to do so. Your doctor will speak with you, or you go to a doctor to get proper advice. Thank you so much for coming, and God bless you on this very important national assignment. We look forward to seeing you again on this program when it comes to diseases like tuberculosis, diphtheria, and them. Thank you so much, Dr. Rufai.
Thank you.
We'll take a break. When we come back, we'll be looking at a Nigerian that has been outside this country for years and doing wonderful things in the area of surgery and pediatrics. Join us again. Hello, welcome back to the Health Show. In the studio with me again is another specialist in another aspect of medicine that everybody is really curious about. We live in the tropics, and there's a need for us to be able to enhance the natural environment towards our healthcare and well-being. How do you do that? People that can do it professionally, pharmacologists, pharmacists, scientists that have been researching into this vegetation under which we live, do something with them for our own benefit. One of such prominent persons sitting with me in the studio today is Professor Benjamin Hamadu. He's a pharmacist and also I'll call him a pharmacologist right now, and a lawyer, and then a researcher into phytomedicine.
Yeah.
We'll be talking about phytomedicine with Dr. Amadu.
Yeah.
Dr. Amadu, you're welcome to the program.
Thank you, madam. Thank you, Nigerians.
So I've mentioned phytomedicine.
Yeah.
Can you please tell us what it is? What is phytomedicine?
Well, I would define phytomedicine, phyto from Latin word meaning plant, medicine in the English ordinary use of medicine. So these are medicines from plant.
Medicines from plant, that's what phyto is.
Yes,
so
simply it can be defined.
So we live in the tropics, like I rightly said. How can we use our natural environment to enhance our well-being and our health?
Well, actually, I should give full definition of phyto, not just...
It's okay. Go ahead.
Phytomedicine is medicinal products obtained, standardized with active ingredients in a plant base, herbal base. And it's a general term that can be used to describe all medicinal products of plant origin. That is the most use of it.
All medicinal products of plant origin.
Plant origin.
Unadulterated.
Unadulterated.
Do you add chemicals to them?
No. For mine, I don't. So that is the simple definition of it. And how did medicine start in the first place? This is where medicine started from. You have heard of cinchona. From the back of cinchona, we got our quinine, chloroquine, aspirin from the miado plants. That is how we got aspirin. From morphine, that you women, when you are pregnant, you want to deliver, is obtained from the small poppy plant that grows by the side of the hill in Pakistan. The morphine, that is the standard for pain all over the world, is gotten like that.
From a plant.
So we live in the tropic here. Most of these plants grow here in the tropic. So the active ingredients of most of these herba are obtained here. They grow well here. In 2003, I did an interview of how I make my medicine from bitter leaf. Bitter leaf grows here very well. It doesn't grow in America. And for me, 10, 50 years later, to hear that people are lined up to buy bitter leaf capsules in New York, they must have stolen it from my interview in my Guardian interview of 2003.
So are you telling us that you've been into phytomedicine for some time?
37 years with over 37 publications. I have.
Okay, so what you're telling us is that whatever you have can be proven by science. If you go, yeah.
You can, how do you write publications? And right now, I'm doing a number of tests with a university in Nigeria. And they are the ones running my whatever.
What is that test about? Just to probe you a little bit. What was that test about?
We have done on a cancer of the pancreas, which you know is one of the deadliest cancers in the world. Created it in animals, 20 of them.
Steve Jobs should have heard about this before, if everything
as a matter of fact, I dedicated to Steve Jobs.
Okay, now tell us what you're doing there. What is it?
20 animals. We bought carcinogens that can cause cancer of the pancreas. We developed the cancer in 20 of them. 4 of them we kept as a control. The remaining 16 we are treating. As I speak to you, today is the 27th day. As we started, we gave them the cancer. All 20 have. The 4 have died because we are just giving them water and their food. The remaining 16, they are jumping up and down because they have taken our drug that can cure the cancer. As I speak with you, they are still alive. But okay, the rest have died.
Okay, we'll wait for the outcome of that research and then we'll come back to you.
That's not the only one. On HIV, we have done the same thing. Our vaccine ran through 6 months. We gave the rabies our HIV vaccine. And as I speak with you, none have developed HIV.
That remains to be proven. To be proven, but
it's no issue.
I believe that phytomedicine has a space.
But I want to plead with the Nigerian government, haven't given me this opportunity. According to a research just published, herbal medicine has $411.2 billion market projected for the year 2026. And we are roaming around $50 million for our GDP to grow.
Dr. Abadu, I know if I gave you 4 hours, you keep talking about this in non-stop. 16 publications in 37 years, it's no joke.
Yeah.
My viewers at home, it's such a pleasure to have been your host, and I will implore you to please join us again next week, same time, same program. We'll bring you another episode of the Health Show. Thank you. My name is Salumi Aferemo.